we are grateful that we have professionals and like you, who can actually educate us, and through which we can actually make some difference. So, sir, talking about same thing, heart health is often like misunderstood, and there are a couple of like misconceptions regarding this. So how should how you have actually encountered this, and how a woman can be educated that she should know the difference between a fact when it comes to heart health as compared to a myth or misconception?
And this is very important to understand that there is a myth which is prevailing since long time that women, they are less affected than men when it comes to heart disease. So actually this is not true, because the data from even US, it is shown that 50,000 more women die because of heart disease every year compared to men. But in this region, I think the figures may be much worse. And the various reasons for this are that in women, they don't have typical symptoms, because in men they have typical chest pain in most of the cases. But in women, the typical chest pain is not there, and women usually present with other vague kind of symptoms, like maybe excess fatigue, or maybe they are having some dizziness, or they are having, like, they're not feeling well, and they may be having pain in the jaw, or maybe headache, or they are not able to do their routine works. And some people, like even doctors, they misunderstand it for some hormonal problem, or maybe they refer to a psychiatrist thinking that the patient is having some depression and anxiety. So if we compare the heart disease in women to that in men, the differences are that although the risk factors are similar, but the risk of having a fatal heart attack or a stroke, which could be debilitating or even fatal, they are more in women compared to men. Like if we compare the risk factors, like smoking, if the woman is a smoker, then the risk of her having a heart attack or a stroke, they are much much more compared to the men. If we compare about obesity, the risk of women having heart attack who after obesity is much more compared to men. And similarly, the risk of like diabetes, like once a woman has diabetes, her risk of getting a heart attack is maybe 4 to 7 times more, while the risk of a man having a diabetes, and the risk factor will be 2 to 3 times more. So when we compare the common risk factors, they are much more severe in women. Plus uh, the incidence of not getting diagnosed as a heart disease is more in women, because 50% of the women, they present for the first time in emergency with a heart attack itself. They have no prior diagnosed incidence of coronary disease, and suddenly they will present with a heart attack. And also it has been seen that those women who are smoking and taking oral anticoagulation, like oral contraceptive pills, like they are also at a much more higher risk to heart attacks and stroke. And if you compare in different age groups, the younger women, they have different kind of heart disease. Like rheumatic heart disease is more common, which damages the valves in young females. And then, like in pregnancy, uh, may have a pregnancy induced hypertension, like the blood pressure rising during the pregnancy. And they may be having diabetes mellitus, which is precipitated during pregnancy. So the blood sugar levels, they start rising, and those patients who have high blood pressure, they are more risk of having eclampsia, which is a severe complication of pregnancy. And those women who have rise in the blood pressure during pregnancy, they are more at risk of getting hypertensive later on also, after maybe 10 years or 15 years. And also women, they have more risk of stroke after pregnancy, and they have more risk of their arteries getting dissected like the artery getting torn after delivery. So the risk is higher in women. Apart from that, there are other kind of diseases which are particularly more common to women, uh, like the microvascular angina. In this, the main arteries, when you do a angiogram, the artery will be normal, but the woman is having angina, like the blood flow to the heart muscle is less because the small branches of the main arteries, they are narrower. And also women are more likely to have what the Japanese have labeled it as a takasubo cardiomyopathy. What happens in this is that because of some emotional trauma, like what we call the heartbreak syndrome, so women more commonly have it, where the function of the heart is deranged. But when you do the routine investigation and the angiogram, the coronary arteries, they are normal. The artery supplying blood to the muscles, they may be normal, but they are having dysfunction where the pumping of the heart is affected. And fortunately, this is a treatable disease, and within few weeks or few months, the patient with some emotional support and few very little medication, the patient will fully recover. And apart from that, like the severity of heart failure is also more in women.
Oh,
And if we compare in the post-menopausal phase, like women who have early menopause or some women who have their ovaries removed because of some disease, so the estrogen hormone is withdrawn, and after that, the risk of getting blockages in the arteries which cause heart attack, it steeply increases, especially in those women who have menopause before the age of 40. And in the elderly age group, the chances of having heart attack, it increases more faster compared to men, but they don't have typical symptoms. So most of the times they get like some different kind of treatments, but the disease is not diagnosed. And also it is seen that in women, even if the disease is diagnosed, the chances of women coming forward for the treatment, they are less compared to men, because always women are so busy in their household chores, with their family, with their some most of the women nowadays they work also, so they keep on postponing the treatment. No, sometimes they say that the kids have their exams, sometimes there's some important thing going on in the family. So they don't prioritize their own health. And yeah, most of the time they are neglecting it. Plus, because the women have more chances of getting obesity, they have more chances of getting diabetes, and their vessels are smaller compared to men.
okay.
So all these factors, they complicate the heart disease more. So the outcome of, even if the women come forward for treatment, the outcome is not as good compared to men. But still, if they get treatment, so the outcome should be good only. So the what I want to emphasize is that women should be aware about all these things, and they should take care of their health and come forward for prevention as well as the management, and not wait for the complications, like if you get a heart attack or stroke and then only you come to the hospital. If you wait, then the outcome will be much worse. And if you take preventive measures, then the outcome will be much better.
Great. Thank you so much, Dr. Puri. I'm sure even when you were telling all this, so I was just kind of, matching it with the information that I have. And there's a lot that I've just learned. I didn't know about this, to be honest. And you have shared the facts exactly, the percentages, which is going to be very useful for the women and young girls out there to understand the severity of the situation, why they need to actually prioritize their heart health, which is really important.